Well, now this is the CT scan, and it is showing the splenic injury. Here I was marking this should be the area of spleen. Spleen is there, but this should all be the area of spleen. But spleen is shattered, and one more finding you are seeing here. This is the liver, and here around the liver you are seeing the free fluid is there. This grayish color, which I am marking this. All the other structures you can identify easily. This is the vertebral body, this is the aorta, this is the SMV, this is SMA, this is kidney, this is also kidney. So main finding you have picked that splenic trauma is there and free fluid around the liver is there. If you like, you are seeing this hypodense area in the liver, and so this is the liver laceration. This is the liver injury, and at least this is the grade 3 liver injury as capsule is breached from at that point, and you are also seeing the fluid around the liver. So, and all of the structures you can identify very easily. This is the vertebral body, this is kidney, this is also kidney, and all other structures. So main finding, at least this is the grade 3 liver injury, and we will discuss further. If you like our content, so in this CT scan you can easily clearly identify that spot, and this is definitely right kidney in this CT scan, while this kidney is normal, this is vertebra, this is aorta, and all the structures you can identify easily. This is liver, these are ribs, so no need to mention. I already explained in a elaborative way. Do subscribe. So again, this is the CT scan, and you can easily identify that liver hematoma is there, and which I am marking. This is the liver hematoma, and what's this white structure here? So actually this is the contrast. We have given the contrast, and contrast is leaking there. It means hematoma is it is still bleeding, and this is the ideal candidate for the angioembolization to control the bleeding. So best management will be the angioembolization in this case. Do subscribe our channel by clicking on the red. So here you are seeing CT scan in various phases. The very first picture like this is without contrast. So no contrast is there, pre-contrast phase. And in this phase, this is the arterial phase. As the aorta, it's bright as compared to the liver. So this is the arterial phase. Okay, and this phase in which the aorta and the liver, they have the same color. So this is the portal phase, and finally the liver is more bright in this diagram, and the aorta, it's less bright. So the contrast has exited from the artery, and this is the delayed phase. The CT scan in 3 phases. First phase in which the aorta is bright, and this is the arterial phase. Next phase, this is the portal phase, and last phase, this is the delayed phase. And in the arterial phase you are seeing the lesion is bright. In the portal phase you are seeing that liver and the lesion both are of same density, so they are almost isodense. And in the last, or you can say that the delayed phase, you can see that the lesion has become the hypodense, and there is a contrast washout, and there is no contrast in the aorta. So the contrast has exited from this, and this is known as the contrast washout, and this is typical of the hepatocellular carcinoma. These diagrams, they are just for comparison, that it's not necessary that all of the lesion becomes bright. Sometimes only wall of the lesion become bright. So this is a contrast. And again, this is the portal phase, and this is the delayed phase. So in this CT scan, what you are seeing, you can clearly see that liver hematoma is there, and I am showing this, marking this, and this is area of spleen. So splenic hematoma and splenic injury is also there. And one thing more I am seeing in this CT scan, that renal injury is also there. Say here I am marking this. Rest of other structures I will not mention here. So in the same city, you are seeing the renal injury, splenic injury, and the hepatic injury also. Do subscribe. So now this is the CT scan, and patient came to us with the right iliac fossa pain, and mental was 6 only, and we added to the CT scan because we were suspicious about the diagnosis. So finally, this is the finding exactly, and this is the fecolith in acute appendicitis. So this is a case of acute appendicitis. Do subscribe our channel by clicking on the red button. So now this is the CT scan, and patient came to us with the right iliac fossa pain, and mental was 6 only, and we added to the CT scan because we were suspicious about the diagnosis. So finally, this is the finding exactly, and this is the fecolith in acute appendicitis. So this is a case of acute appendicitis. And this is the CT scan showing the shattered left kidney, and you are seeing the expanding hematoma here in this diagram, in this section of the CT scan. Do subscribe our channel by clicking on the red button below, and don't forget to press the bell icon also. Well, this is the CT scan showing the abdominal aortic aneurysm. This is the area of the aorta, and you can clearly visualize the diameter of the aorta is too much. And is it bleeding or not bleeding? So it is bleeding at this point. It's the ruptured, and you can clearly see the free fluid in the abdomen in this portion. So this is a case of ruptured abdominal aortic aneurysm, so clearly visualized. This much diameter is not normal. If you like our content, if you learned something from our video, so this case of the pseudomyxoma peritoni, and you can clearly see that the peritoneal thickening is there, which I am marking, and peritoneal deposits are there at this spot. So this is a typical case of the pseudomyxoma peritoni. This is just so that you might be able to identify this pathology. So this is a case of pseudomyxoma peritoni. Do subscribe our channel. So this is the CT scan showing uh, so this is the CT scan of the abdomen Why I am saying, so you can see the thickness of the wall of the cecum is too much. This whitish area, this is the lumen, contrast showing the lumen. So you can see easily the lumen is very small and wall it's too much thick. So all this is contrast, this is contrast, this is contrast, this is contrast. So this is the case of the CA cecum. Okay. Do subscribe our channel. This is the CT scan showing the calcification of the gallbladder there, and the calcified gallbladder. What you call calcified gallbladder? Porcelain gallbladder. Okay, so this is a CT scan showing the porcelain gallbladder. Do subscribe our channel by clicking on the red button. So this is the CT scan showing the free fluid in the pelvis. So just to show you that fluid will be looking gray. Do subscribe our channel by clicking on the red button below.